Okay, we're now live.
Okay, thank you, Emma. Right, without more ado, shall we go to Joe for the very first item, which is public health grants to NHS organisations?
Yes, thank you. So this paper is, as Councillor Fair has said, to come for decision for public health grants to NHS organisations. As the paper sets out, this is a request to be able to pass award money to named NHS organisations from the Contain Outbreak Management Fund for activity that sets to mitigate the impacts and inequalities that have been exacerbated by COVID, looking specifically at interventions around prevention of cardiovascular disease, mitigation of mental health and issues, and linking into the inequalities programme at the ICS level, which is called Core 20+5, and that is a programme that nationally across the NHS has been implemented to provide a framework for NHS organisations to work to mitigate the effects of health inequalities by looking at the 20% most deprived areas that they cover and 5 particular clinical conditions which are which burden mostly people who are living in those deprived areas. As I said, it's would be funded through COMP and it's for a total of £3 million. It's important to note that this funding, although it would be awarded to NHS bodies as part of Hampshire and Isle of Wight ICS, would be for interventions for Hampshire residents. And we're seeking for delegated authority to the DPH in consultation with the lead member to award this funding.
Thanks, Joe. Can I just ask about this cardiovascular? Because we're still doing the health checkups, aren't we?
Yes, so the health checks, the NHS health checks are a mandated intervention that local authority public health teams must commission and find ways to provide. We do have there is a backlog because so many health checks were missed during the pandemic, and that is separate to this piece of funding. So this piece of funding would be for NHS organisations to take forward work largely once the health check has been done and it's been identified that people may have a need. There is a lot of other work that can be done in that space, a lot of work around enabling people to check their own blood pressure and to put in place the relevant interventions once perhaps high blood pressure has been identified. That's just an example. There could be other activities.
Yes, so residents will be passed on to these things if and when a problem is detected.
Absolutely.
Yeah.
Yeah, okay. and to develop those pathways, across our various different providers.
Thank you. Bill, Councillor Withers, sorry.
Firstly, the Health Equity Committee I sit on has been doing a lot of blood pressure testing at the Morrison's, Tesco's and the Wellington Centre with good success in identifying people with high blood pressure and also people with heart ailment. So it is working and a lot more is needed. And as you said, it is part of the Core 20+5. What came up at the HASC meeting recently was the fact that there is a difference between certain districts in that some get a health check at 75 and a few get it at 70. But the policy seems to be at 75 at the moment, which has astounded most of the committee members, that it was such a late age and actually isn't well known. So I think we do need to look at that seriously, but I'm in full support of the grant for these sort of core elements to be achieved, because at community level through the PCNs, it's so important that the teams get out and about to where the public is, as opposed to expecting the public to come to them. So I endorse it.
Joe,
Thank you
did
very
you
much.
want to come back on the health checks at 75
Yeah, just to,
or 70?
yes, just to slightly clarify, some of the terminology is sometimes a bit lazy, I think, that we all use. The NHS health check that is a mandated requirement of local authority public health teams is the health check that is offered when people reach the age of 40. And it is very much a preventative health check to identify early indicators and risk factors for these conditions. And the health check that happens at 70/75 is a slightly different intervention. It's equally as important, but it's not necessarily what we're talking about here in terms of that cardiovascular pathway. But it is still important in the wider scheme of things.
Yeah, I think the point I'm trying to get across, Joe, is when I asked all the committee members who'd had a health check at 40, I think there were 2 people. So there is a problem in that not everybody's getting it due to the pressure. But I was just highlighting that there was an agreement with the ICBs between whether it was 70 or 75.
Right,
So
I see. Yes, sorry.
It's still being rolled out, which is important. Obviously, because as I said, cardiovascular is very important. Obviously, smoking is a key element of that. So I was just stating really that HASC did identify that it's an aim, but it still needs a bit of jointry between the 2 ICBs.
Absolutely, yes. And hopefully some of this would be able to support that pathway.
Good, thank you, Joe. Councillor Warwick.
Thank you, Councillor Fairhurst. Joe, thank you so much. There's an interesting point that Councillor Withers raised, and I just wonder if that's a piece of work we might look into is the uptake of health checks, because that's important. And I'm guessing somebody's got that information somewhere, but by demographic, by area and by age, that would be very important to know who we are reaching. And the other that follows on neatly from that, and this is a significant grant, is how you monitor the outcomes, particularly in mental health, which is probably quite hard to measure compared to perhaps cardiovascular. Blood pressure is quite straightforward to measure.
Yes, I agree. It is really important to measure, to make sure that any funding that we would be providing as a council, that we have robust monitoring plans in place for that. And part of the workup of anything that we would be doing as part of this award, we would definitely want to include strong monitoring within that. The way that the paper is written, we have an idea that we know that interventions are needed in that space, and part of the work would be to work those up, and in doing so, to make sure that we've got appropriate monitoring arrangements.
Thank you.
Thanks. Councillor Briggs, welcome. And I know you came in at the sort of tail end, but did you have any questions for Joe?
Well, no, actually, I'm giving apologies because I've just returned from holiday and I hadn't read. I'm just really here to listen. But to carry on, so apologies because I haven't read it, so I can't really comment. But to carry on from Councillor Withers, in my area, it stops at 75 for your heart cardiovascular checks, and I would have thought that was really important to carry on having it when you're over 75. That's all I can comment on because I haven't read it, so apologies.
No, we'll probably have an army of over 75s marching on the GPs now, insisting on having their heart checked. But
yeah, it is important.
Yeah, Jess.
I just wondered whether it was helpful to point out that the Hampshire mental health wellbeing strategy has got really well developed KPIs, and as I understand it, the funding is supporting that strategy. So it might be that you could use those KPIs in terms of monitoring the effectiveness. They do seem well developed. The other thing I just wanted to mention on behalf of Graham is that I know that Simon has briefed opposition with regard to the paper, and this applies actually to all the decisions today. And Councillor Taylor was in attendance and had no questions or issues with the paper. She was supportive.
Thank you. Thanks, Jess. Jennifer, have you got any problems with this paper?
No, none at all, Councillor Fairhurst.
Good. No problems with the money?
No, everything's fine with this report from the financial viewpoint. The money's been set aside and it's there waiting to be utilised. Thank you.
Okay, thank you. Right, Joe, for that one, thank you very much. More than happy to approve.
Thank you very much.
And I know you're in the hot seat, so we'll go straight on to the integrated sexual reproductive health provision. I think that's what you call it, yes?
That
Yeah.
is correct. So this paper, like the health checks, provision of an integrated sexual and reproductive health service is a mandated responsibility for us in public health. We currently have a service that is provided by NHS Solent, and that contract will be it's in its final year currently. So this paper is setting out the rationale for re-procurement of an integrated sexual and reproductive health service. This would be funded from the public health grant. The money associated with this is up to a total of £63.3 million over a period of 9 years, and the intention is to go out for a 7+2 contract. We are, as we did for the current contract, intending to do a collaborative commissioning arrangement whereby we would have a single service specification with some nuance for each place. So we're commissioning, we're coordinating that commissioning with our colleagues in the Isle of Wight Council, Southampton City Council and Portsmouth City Council. But within that, or to support that, there would be 4 separate contracts, and all the finance would be completely owned by the independent local authorities. Because of the importance of integrated pathways for HIV prevention and HIV treatment and care, and the link between HIV and other sexually transmitted infections, we're also working very closely with our colleagues in NHS England Specialised Commissioning, who are the responsible commissioners for the HIV treatment and care part of that. So it's an extra element of service provision which wouldn't be commissioned by us, but that we are co-commissioning it at the same time with NHS England as a separate commissioner. But the tender would include both of those things within an integrated service provision, as well as an additional element from NHS England, which is to provide opportunistic cervical screening for women. And that is not to replace the larger kind of part of cervical screening, which is usually provided through primary care, but it's to add an extra choice, really, and to bear in mind that for some women, the sexual health service might be the only place that they would seek that kind of medical care, and to be able to offer cervical screening once people are there really just adds an extra level of provision, particularly for vulnerable women. So NHS England would also put that into their part of the service provision. I think that's kind of everything that I wanted to say about that, but happy to take any questions because I know there's a lot of information in the paper.
Yes. Can I just ask, Joe, we're doing this in conjunction with the other cities and that, but our money is for Hampshire.
Yes.
What happens if a resident of Hampshire is too embarrassed to go to one of ours, who goes to Portsmouth, and vice versa? Because that happens all the time. And I know a lot of youngsters come off the island to seek help, either in Portsmouth or Southampton.
Absolutely. So our responsibility is to provide open access services, not just so for our residents wherever they go, but also to ensure that there is provision for residents of any other place to access our services. And there is for places outside the 4 local authorities, there is an arrangement in place with a separate budget, which we note in the paper, but isn't included within the provision. And so, if somebody from Huddersfield rocks up and decides that they need to, seek support whilst they're in Winchester, that would be for Huddersfield, if that's the right council, to invoice us, and we would do that. But between the 4 councils, one of the benefits of going out this way is that we wouldn't be, kind of penalised for that out of area, but within the locality, moving around, and that would all be accounted for within the service. So for our residents, we would pay for them, whether they go to Southampton or Portsmouth, but we wouldn't pay any more than anyone from their councils coming to us.
Mhm. Yeah, no, that makes sense. And can I just ask a completely off the radar question? Having been to the place in Eastleigh, which I think is absolutely fantastic, are all our centres as good as that, or is there any way we can make them as good as that?
So not all of our centres are as attractive and accessible as the centre in Eastleigh. Some of them are within, well, the majority of them are within NHS estate, and some of that is fairly ageing. All of the level of clinical care that people will get when they access those centres is of high quality. But you're right that the one in Eastleigh is a bit of a beacon, and it is new, it is shiny, it's very accessible. Unfortunately, not all the centres are like that. I think it's important that when we go out to to tender for this service, that we're thinking about how people can access, and the geographical location is important. We would obviously want all of the estate, the sites to be clinically appropriate, and we're very keen to ensure that people can access easily by public transport, particularly young people. But it's quite challenging to be able to put such a specific requirement into the tender. But obviously, if those things, if it comes up that estate is, if we get a completely different provider coming forward, we would have to work with them to find estate in the same way as we would for anyone.
Okay, thanks, Jo. Councillor Withers.
Yep, Jo, can I just clear that the funding that we have for Hampshire has come to us purely for Hampshire, and that the funding for Southampton and Portsmouth is direct to them?
Correct.
And it's for the 7 years, the first contract, and 2 years extension, as you said earlier?
Yes.
Yeah, okay, so, yeah. There's some hidden issues there, that's why I asked that, but thanks for that.
Have we built inflation into that figure? Because over 9 years, things are going to change quite dramatically, I should imagine.
So we have estimated a 2% inflation over the lifetime of that contract within that figure that we've put forward.
Okay, thank you. Councillor Briggs.
I think I will say the same. I haven't read, and I will read after this. I couldn't access it in Cornwall. I couldn't get anything through, but obviously anything to do with prevention, I would, be supportive of.
Good, thank you. Councillor Warwick.
Yes, thank you very much. I think this is a great paper, and it's a really important topic for young people. I've always noticed, Jo, there used to be a lot of marketing associated with sexual health, particularly around chlamydia services in the past. Is the marketing strategy part of that tendering process? And the other question I was going to ask is, I mean, how many providers realistically are out there that, is this likely to change? I've got no idea, but it's a huge contract potentially, isn't it? And I just wonder if you could give us a flavour of who's likely to be bidding for this out there.
Yes, so I'll take your two questions in order. So in terms of the marketing, particularly around chlamydia, there has been a slight change of rationale in the National Chlamydia Screening Programme, in that it is now much more pointed towards women. It doesn't exclude men, but outside the specialist service that we're commissioning, there is no longer such a drive to do kind of what I might call the kind of spray and pray testing approach, where we're just trying to test huge numbers of people, because evidence over the 10 years of the programme has shown that is perhaps not the most cost-effective way of actually identifying cases, and cases are much more likely to be found in specific demographic groups, some of those who are accessing these services, and we want the service to be reaching out and using, as you say, marketing techniques to be able to attract the right people into the service, and not perhaps the worried well type of individuals. And we're really keen to ensure that in the new service specification there is a real push on the use of digital campaigns and targeted social marketing. It's not always something that NHS providers on their own are brilliant at doing, and we've been quite clear in some of the pre-market engagement that we would really welcome kind of joint approaches from perhaps subcontractors or people who organisations that have specifically set out to provide online testing, for example, with associated marketing. So we haven't ruled that out. In terms of the market for specialist sexual health services, prior to kind of moving forward with this planning, we have done a bit of work across the South East with other commissioners. It's not a large market. I don't think we're going to be inundated with providers, but there is sufficient interest, or there has been in other places that have gone out to tender recently, that we felt that there was a competitive market that has led us to this point that our intention is to go out to competitive tender. Largely, the services across the country are provided by NHS providers. It's a very specialist clinical service. In some places, providers, that maybe about 5 or 6 years ago, there was quite a lot of interest from Virgin. That has not been sustained across the country in many places. And in a few places, organisations such as Brook, which largely used to concentrate on younger people and very much the prevention and promotion side of things, have moved into the provision of clinical contracts. But locally, it is a pretty small market.
Brilliant. Thank you so much. That's a really helpful answer. Thank you.
Right, Jennifer, any worries?
No comments from me, Councillor Fairhurst. Thank you.
And Dave, it's an awful lot of money. Are you happy with it?
Yeah, I'm happy with the report as it stands and the amount that's been allocated. I would just point out one thing, obviously, notwithstanding the 63.3 over the 7 to 9 years it's been approved. Obviously, public health team are more than well aware they have to bring all within the budget allocation they have each year, which is obviously dependent on the public health grant. And so whilst if there were to be any further reductions in the public health grant, I'm not saying this service would necessarily be affected, but some services would have to be affected, and they would have to both live within the 63.3 that's been approved and the annual budget that we've got each year. So it's worth pointing that out.
Yeah.
Thanks, Dave.
Right. Well, taking into account, I'm still very happy to approve it, bearing in mind what Dave says about possible future grants. Okay.
Thank you very
Jo.
much. Thank you, Councillor Fairhurst.
That's okay, Jo. You've got one last one, and then you're off the hook.
Excellent. So the last one, we started with COMF. We went to the public health grant. We're now back to COMF, to the Container Outbreak Management Fund.
Mm-hmm.
So this paper is similar but different to the first one, in that it is setting out a proposal to spend on interventions to ameliorate some of the impact of the COVID pandemic on people's physical and mental health through provision of physical activity related interventions. So the paper is setting out the request to approve grants to the value of £1.5 million. And the idea is that we would do this through procuring an external provider to kind of run that grant scheme for us. The funding would continue, the bulk of that funding would continue to be held by Hampshire County Council, with a proportion of that funding going to the organisation who would run it for us. There are strict criteria, as you know, around the Container Outbreak Management Fund, and within the paper you can see that we've set out criteria around the grants themselves. the idea is that those grants would go to organisations which are able to really reach in to communities, particularly into deprived communities. We know that physical activity has many benefits for both physical and mental health, and also that prior to the pandemic, there was more deprived communities are less likely to be physically active, and actually that gap widened during the period of the pandemic and has not, there's no sign of it becoming narrower again. So these physical activities are set out to be able to mitigate some of those impacts of the pandemic directly, but also the impacts on the wider inequalities that have been experienced by these particular communities. And what we would like to happen is that lead provider kind of manages this for us, and the grants are actually awarded to organisations which are able to work directly with communities. That might include our districts and boroughs, but also very much thinking that smaller voluntary sector organisations would be in a really good place to be able to do some of this work. We have put a cap on the value of each individual kind of award, up to £100,000, and we would anticipate the grants all being allocated by March 2024 to fit with the guidance that we've had around spending the CONF grant.
Right, thanks, Jo. I noticed a bit about might be using local districts and boroughs. I was so impressed by the work Energise Me did with that group of mothers and grandmothers in Lee Park, but using one of our schools. And some of those ladies who've been socially isolated, been overweight, no exercise, no nothing. A couple of them now actually are going out to work, which, is fantastic.
It's a great outcome, isn't it?
It was a great outcome. What concerns me is, have we spoken to Children's Services about opening more of our schools for running that sort of programme for the mothers and the grandmothers in their area? These were people who said they'd never go to a gym, but they'd go into the school, and they did, and with tremendous results.
But those conversations, when we were in conversation, ongoing dialogue with Children's Services, I can't answer your specific question about schools, but I can certainly go back and find out if those conversations are live. But there is no, there wouldn't be a barrier to a school community or a parent and teacher association kind of bidding for any of these grants. And as we work up the kind of communications around this, if it is approved, then that would be certainly something that we could seek to do.
Yeah, I think we need to get the message out to the schools. And I know we sent the film. I'm sure Councillor Withers, Councillor Briggs, you probably saw the film. Jess, did you see it from Energise Me? No. Absolutely brilliant about how they felt at home in the school, because they were in the gym, but there was only, just them. And it made such a difference. And I thought lots of our schools have gyms like that with the machines that aren't used all day, every day. But, if we can get mothers and grandmothers and that in there, it will make a great difference. Anyway, sorry. Councillor Withers, over to you.
No, I totally agree, Councillor Fairhurst. I think a lot of the schools in my area used to do that. Certainly the senior schools always did. Connaught, which is now Alderwood, used to have an evening fitness class, which disappeared. And actually it would be a great thing to bring it back. I thoroughly support these sort of activities, and I'm not sure whether you watched the BBC News this morning about people that through a London musical opera company, the breathing exercises, which brought a choir of 85 people that suffered severely with COVID, being taught how to breathe properly again, and then being taught how to sing again, to do a concert in Covent Garden for 2,500 people. I've got a lot of people in my division and actually in Rushmore who still can't breathe properly. And the exercises, even though we're told to breathe through our nose, is far more efficient. but using the techniques that the opera singers use is obviously being proven successful in restoring covert sufferers back to as much normality as they can achieve. And I think we need to not only look at the long-term health and disability issues in our deprived wards, of which my worst is average Citizens Advice Bureau benefits is 35 to 45 plus age group. We need to look at those activities to bring back people from no hopers to actually being hopers to get out there.
Jess, you wanted to come in.
Yeah, so this is really exciting opportunity, Liz. It certainly sounds really interesting, the video you described. I'm aware also of some of the great work that's been going on around physical activity for older people, and just to say that when this does get taken to tender, it would be really good to appeal to those organisations who have got experience in working with people with disability. So whilst it doesn't appear explicitly in terms of the health inequality element, the obviously older age and also disability does absolutely impact upon people's opportunity to, and yet it's absolutely crucial, isn't it, for to prevent deterioration and to support people's health. So yeah, it would be great if we could work with Peter Stokes to make sure that those things get out to our social care VCS as well as to the wider population. So they
Yeah, we can absolutely do that. That sounds, yeah.
That's
Great.
really good.
Make sure that that's all linked up.
Thank you.
Councillor Warwick.
Yeah, just to go on about outcomes again, you've alluded to how powerful an outcome can be when you say that people who came into the schools for extra physical activity had the confidence then to take up jobs. That's a really powerful message. So I think if we can follow up on the outcomes of this grant, I think that's the most important thing, because we're always having to justify how we spend our money. And I think we've potentially got some really good results to share. So that would be really important, Joe, if you could follow that up. Thank you.
Right. Jennifer, any problems?
None at all,
No.
Councillor Fairhurst, thank you.
No. Good. And Dave, you're happy with the money, I take it?
Yes, again, the money is set aside from the Containment Outbreak Management Fund, and they're ready to be utilised. Thank you.
Super, thank you. Thank you all. I know we've got one more thing, but Joe, that's you finished. So thank you very much.
Thank you
And
very
I'm
much.
sure
Thank you, everybody.
I'm sure Simon's very grateful that you stood in for him. Okay, thank you.
Thanks a lot. See you all later.
Thanks.
Bye.
Bye. Right, the last item is for someone to go on to UHS as our rep. It was Councillor McAvoy, and it is going to become Councillor Edward Heron for this year. Is that right? His term will finish in 2025? From now till
That's right. It'll be
2025.
reappointed, yeah, next year.
Yeah, good. Okay, so it's Councillor Heron. All right.
Thank you.
So, thanks, Emma. Okay, so thanks very much, everyone. Have a nice afternoon. Enjoy the weather while it lasts. Yes? Okay. Jan, you must be shattered. Oh, sorry, Emma, can you switch off the recording? Sorry.
Yeah, that's okay. I'll just have